heard, and of the Commission as a whole, will be the long-term as well as the immediate impact of the Shaping a Healthier Future programme, the provision of health services, which is currently underway in North West London. The background to this is that in 2009, work began on a programme, the purpose of which was intended to shape a strategy to provide sustainable, high-quality health services throughout the region. The premise upon which this work was commenced was that there was a pressing need for change based on the increasing healthcare demands of a rising and ageing population, and that there was unacceptable variation in levels of service across and within the region's hospitals and other facilities. It was said that to do nothing was not an option. In late 2011, this work evolved into the Shaping a Healthier Future programme. There then ensued a pre-consultation phase, during the course of which the bodies involved in the process gathered information and arrived at a series of what they considered to be the possible options for change. These were then whittled down to 3 potential options, which became the subject of a public consultation in July 2012. The broad thrust of the proposals presented for consultation were that whilst 5 of the 9 hospitals in the region were to continue to provide the full range of services, including accident and emergency facilities, the remaining 4 were to adopt reduced or more specialist roles. The changes to acute hospital services were to be offset by the development of enhanced out-of-hospital provision and other associated services. The 3 options presented for consultation were all variations of this plan, with the stated benefits envisaged being those of increased quality of care, improved access to care, and cost benefits. In February 2013, the decision-making business plan setting out the projected costs and the cost benefits of the proposal was published, and the Joint Committee of the Primary Care Trusts, which was the then decision-making body, approved the programme. Over the course of the consultation, and following the adoption of the proposal subsequently chosen, there ensued a considerable degree of controversy, which generated a number of reviews and reports in which divergent views were expressed about both the decision-making processes and the substance of the programme itself. Following a formal referral by the Adult Services Arm of the London Borough of Ealing in March 2013, a review was undertaken by the Independent Reconfiguration Panel at the behest of the Secretary of State. Although identifying some areas of uncertainty and making some recommendations, the Reconfiguration Panel broadly endorsed the proposals for change. Implementation of the proposals then began and has, since mid-2014, been in the process of being rolled out across the region. By December 2014, when this commission was established, a number of key events, including the closure of the Accident and Emergency Departments at Hammersmith and Central Middlesex Hospitals, the opening of the new accident and emergency facilities at Northwick Park Hospital, and the merger of the North West London and Ealing Hospital Trusts have taken place. Further significant changes are taking place on a continuing basis, with perhaps the most obvious current issue being the planned closure of the maternity facilities at Ealing Hospital, a decision about which, until very recently, we understood it was to be taken this week. That has now been subject to further delay. The purpose of this commission is to engage in a transparent, open-minded exchange with all interested parties, to examine the decisions made thus far, and to look afresh at whether those decisions and the plans arising from them are indeed those that are best able to provide the optimum available healthcare and linked social care services to the residents of this region, or, if upon fresh examination, there are other alternatives which might be as good or better and which merit exploration. Given that the implementation of Shaping a Healthier Future is well underway and that many of the plan changes are already in midstream, the emphasis of these hearings will be on the aspects identified by the commissioning bodies as being of the most immediate and most critical importance for the residents of the region. It will surprise no one that chief amongst these are the changes to A&E and acute services, the closure of the maternity unit in Ealing, the perceived lack of progress in provision of out-of-hospital services, and the financing of the programme. The Commissioners are, as you've heard, keen that the voices of as many of the individuals or organisations that wish to be heard in the process can be. So, with that in mind, and with the permission of the witnesses, the Commissioners, may I now call Mr. Andy Slaughter, the first witness.